Imagine staring at an ultrasound screen for 9 long months, watching the tiny heartbeat, the gentle kicks, the gradual formation of fingers and toes, only to discover at the moment of birth that there was another baby hidden inside the womb the entire time. How could a twin remain invisible through countless scans, medical appointments, and careful monitoring? Today, we're diving into one of the most fascinating and misunderstood phenomena in prenatal medicine, the hidden twin. Using real ultrasound imagery, anatomical explanations, and surprising medical case studies, we'll explore how modern technology can sometimes miss what seems impossible to overlook. And the twist may shock you because, in rare cases, the second twin doesn't reveal itself until labor begins. Pregnancy is often described as a journey of discovery, but what happens when that journey holds a secret no one sees coming? In today's educational video, we're exploring the science behind how a twin can hide for 9 months and why even advanced medical imaging sometimes fails to detect a second baby. From early ultrasound limitations to rare biological positioning and developmental phenomena, we'll break down the anatomy and medical explanations in a clear and engaging way. If you're fascinated by pregnancy mysteries, rare medical cases, and the incredible complexity of the human body, make sure to like this video, subscribe to the channel, and turn on notifications so you never miss another deep dive into extraordinary human biology. Pregnancy monitoring has evolved dramatically over the past decades, especially with the widespread use of ultrasound technology, which allows healthcare professionals to visualize the developing fetus in real time. Ultrasound works by emitting high-frequency sound waves that bounce off internal structures and return as echoes, forming an image on a screen. While this technology is remarkably effective, it is not infallible. The clarity of an ultrasound image depends on multiple variables including gestational age, maternal body composition, fetal position, equipment quality, and the experience of the technician. In early pregnancy, embryos are extremely small, and if 2 gestational sacs are positioned very closely together, one embryo may be partially obscured by the other. In some cases, overlapping tissues or shadows can create visual ambiguity, especially during the first trimester when structures are still developing. Although modern equipment is highly sensitive, the dynamic and fluid nature of the womb means that images are interpretations of echoes, not direct photographs, and interpretation can occasionally miss subtle distinctions. One of the most common explanations for a hidden twin is a phenomenon known as superfetations, more recognized relative superimposition of embryos, where one twin is positioned directly behind the other within the uterus. When this occurs, the ultrasound beam may capture only the twin closest to the probe, while the second remains concealed in the acoustic shadow created by its sibling. This effect can be particularly pronounced in monoamniotic twins who share the same placenta and may develop within a single gestational sac. In such cases, distinguishing individual fetal structures can become challenging, especially if the twins are pressed closely together. The fluid-filled amniotic sac normally enhances visibility, but if one twin is consistently aligned behind the other during multiple scans, the repeated imaging angle can perpetuate the illusion of a singleton pregnancy. While technicians are trained to identify multiple pregnancies, rare positioning patterns combined with technical limitations can allow a second fetus to go unnoticed. Another factor involves the timing of early ultrasounds. Many initial scans occur between 6 and 8 weeks of pregnancy, when embryos measure only a few millimeters in length. At this stage, a twin pregnancy might initially appear as a single gestational sac, particularly if the second embryo is developing slightly later or is smaller in size. In some cases, delayed implantation can cause one embryo to lag behind in growth, making it more difficult to detect. Additionally, if one twin temporarily exhibits minimal cardiac activity or limited movement, the lack of visible motion can reduce suspicion of multiplicity. Early gestational imaging relies heavily on identifying yolk sacs and fetal poles, and if these structures overlap or are tightly clustered, distinguishing separate embryos may require very specific scanning angles. A slight variation in probe positioning can dramatically change what is visible on the monitor, and subtle differences may not always be immediately recognized. In rare circumstances, a condition known as vanishing twin syndrome adds complexity to the narrative. This phenomenon, documented by organizations such as the American Pregnancy Association, describes cases in which one twin appears early in pregnancy but later seems to disappear due to natural resorption by the mother's body or the surviving twin. However, occasionally the opposite scenario can occur. A twin believed to have vanished may still be present but positioned in a way that masks its ongoing development. This is exceptionally rare, yet medical literature has documented unusual presentations where diagnostic assumptions were revised later in gestation. The placenta itself can also obscure visualization. If one twin implants behind a thick placental wall or near the posterior uterine lining, imaging waves must penetrate additional tissue layers, potentially reducing clarity and creating interpretive challenges. Maternal anatomy plays a crucial role in ultrasound accuracy as well. The uterus is not a rigid, symmetrical container but a dynamic muscular organ that expands unevenly based on fetal growth and positioning. Variations such as a bicanute uterus, fibroids, or unusual uterine tilting can create compartments or angles that obscure a second fetus from standard imaging views. Additionally, maternal abdominal tissue density can influence sound wave penetration, affecting image resolution. Although modern high-resolution machines compensate for many of these variables, earlier or lower-quality equipment may struggle to capture subtle details. Even with advanced 3D and 4D imaging technologies, which provide more comprehensive spatial visualization, the orientation of the fetus remains a determining factor. If one twin consistently maintains a posterior or transverse position relative to the ultrasound probe, repeated scans may inadvertently overlook the additional presence. Amniotic fluid levels can also influence detectability. Adequate fluid creates a clear acoustic window, separating fetal structures and enhancing visibility. However, if fluid distribution is uneven, one twin might be enveloped in a tighter fluid pocket while the other occupies a more spacious area, resulting in disproportionate clarity. In monochorionic diamniotic twin pregnancies, membranes between the twins are extremely thin and sometimes difficult to visualize. If these membranes are not clearly seen, practitioners might interpret the image as a single fetus with unusual limb positioning. Furthermore, fetal movement patterns vary widely. Some fetuses are highly active during scans, while others remain relatively still. A twin that consistently minimizes movement may blend visually into the silhouette of its sibling, especially if limbs overlap and heartbeats synchronize rhythmically. The timing of prenatal appointments can contribute to misdetection as well. In low-risk pregnancies, routine ultrasounds may be limited in number, often focusing on early confirmation and mid-pregnancy anatomical surveys. If both of these occur during moments when the second twin is obscured, there may be no clinical reason to suspect multiplicity. Physicians rely on measurable indicators such as fundal height, maternal weight gain, and fetal heart tones. But variations in these measurements can fall within normal singleton ranges. In certain rare cases, the second twin may occupy a position that does not significantly alter abdominal measurements, without additional risk factors prompting further imaging. The pregnancy may continue under the assumption of a single fetus. One of the most dramatic scenarios occurs when the hidden twin reveals itself only during labor. As uterine contractions intensify, fetal positioning shifts significantly. The pressure and movement can dislodge a twin from a concealed orientation, making its presence suddenly apparent after the first baby is delivered. In hospital settings, practitioners routinely check for additional fetuses following birth in known multiple pregnancies, but in unexpected cases, the discovery can be startling. Reports from obstetric literature describe situations where a second amniotic sac ruptures moments after the first infant's delivery, revealing an entirely unanticipated twin. These events underscore the dynamic nature of labor, during which anatomical relationships within the uterus transform rapidly and dramatically. From a biological standpoint, twin formation itself varies considerably. Identical twins arise from a single fertilized egg that splits, while fraternal twins result from two separate eggs fertilized simultaneously. The timing of embryonic division in identical twins determines whether they share placentas or amniotic sacs, influencing how closely they develop together. The closer the physical proximity, the greater the potential for overlapping anatomical structures that complicate imaging. In rare monoamniotic cases, twins share the same sac entirely, increasing the likelihood of intertwined positioning. While such pregnancies are typically identified due to higher risk monitoring, unusual spatial arrangements may still challenge visualization. Technological advances continue to reduce the likelihood of hidden twins. High-frequency transducers, Doppler imaging for detecting multiple heartbeats, and comprehensive anatomical surveys have dramatically improved detection rates. Institutions affiliated with organizations such as the American College of Obstetricians and Gynecologists provide guidelines that emphasize careful evaluation of placental structure and amniotic membranes to identify multiplicity early. Yet medicine operates within probabilities rather than absolutes. Even the most advanced imaging systems depend on interpretation, and interpretation is shaped by context, experience, and expectation. Psychological factors may also influence perception. When clinicians expect to see a singleton pregnancy, subtle indicators of a second fetus may not immediately register as significant. Cognitive bias, though minimized by training and protocols, can affect diagnostic interpretation. For example, overlapping limb movements might be attributed to image artifact rather than distinct anatomy. Modern training emphasizes systematic scanning approaches to avoid such oversight, including sweeping the probe across multiple angles and documenting placental cord insertions carefully. These standardized methods have significantly reduced missed twin diagnoses compared to earlier decades. Statistically, undiagnosed twin births are exceedingly rare in regions with consistent prenatal care. However, they are more likely in situations involving limited access to advanced imaging, late prenatal initiation, or unusual anatomical conditions. In some rural or resource-limited settings, early ultrasounds may not be performed at all, increasing the chance of surprise discovery at birth. Even in technologically advanced hospitals, rare anomalies remind practitioners that biology does not always conform neatly to expectations. Each pregnancy represents a unique anatomical arrangement influenced by genetics, implantation patterns, and uterine environment. Another intriguing explanation involves asymmetric growth restriction. If one twin grows significantly smaller due to placental insufficiency, it may remain overshadowed by the larger twin's development. The smaller twin's reduced size can make detection more challenging, particularly if clinicians attribute minor discrepancies to measurement error. Close monitoring typically identifies growth restriction, but if the smaller twin is consistently concealed behind its sibling, distinguishing separate bodies may require exceptionally detailed imaging. In extreme cases, the second twin may only become evident once labor repositions both infants. Ultimately, the concept of a twin hiding is less about deliberate concealment and more about anatomical alignment and technological limitation. The womb is a fluid, three-dimensional environment in constant motion. Ultrasound captures two-dimensional slices of that environment, reconstructed into images that must be interpreted in real time. When those slices repeatedly align in ways that obscure duplication, the illusion of singularity can persist. Although rare, these cases highlight both the sophistication and the boundaries of medical imaging. When the hidden twin finally moves during labor, shifting into view as contractions intensify, the revelation can feel almost cinematic. Yet beneath the shock lies a reminder of biology's complexity. The human body develops according to intricate processes shaped by chance and structure. While modern medicine has made remarkable strides in visualizing life before birth, it continues to operate within the constraints of physics, anatomy, and probability. The hidden twin phenomenon stands as a testament to the remarkable unpredictability embedded within even the most carefully monitored pregnancies. The idea of a twin remaining unseen for 9 months challenges our confidence in technology and reminds us that nature still holds mysteries beyond our full control. A hidden twin is not magic, nor myth, but the result of positioning, anatomy, timing, and the interpretive limits of imaging. It reveals how extraordinary and complex prenatal development truly is. As science advances, such surprises grow rarer, yet they continue to teach humility within medicine. Every pregnancy carries layers of unseen intricacy, and sometimes, even with careful monitoring, life finds a way to remain hidden until the very last moment.